Welcome to Healing Outside the Box. My name is Jean Tiberio, and I'm a nutritionist and a wellness coach. You're listening to episode 269, and I'm calling it The Imperfect Nature of Cholesterol-Lowering Drug Clinical Trials. Now, how many times have you heard the phrase, studies have shown? Studies have shown what exactly? Can we trust that information? This is a bit of a follow-up on my last episode, which was about how statins work. In case you're not on them, statins are cholesterol-lowering drugs that lower blood cholesterol or blood lipids, or sometimes both. I mentioned possible side effects when I was talking about statins, but that leaves open the question, are taking these meds worth the possible risk of side effects? Well, only you and your doctor can make that decision for yourselves. And the disclaimer I mentioned in the last episode applies here. Namely, I'm not a doctor and cannot make these decisions for you. I merely want to give you the information that you can use to make the decision for yourself. And it probably will not come as a shock to hear that I have a bias towards healthy eating and hopefully prevention of chronic disease. Having said all that, I want to tell you the story of when I was involved in a clinical drug study with the cholesterol-lowering drug called Lopid, also goes by gemfibrozole. It is made by Parke Davis, which now is part of Pfizer. But first, a little background on clinical trials in the outpatient setting. And then I'll briefly go over Lopid's mode of action and side effects. Now, in general, there are two types of clinical trials. This is in the outpatient setting. They are either descriptive or analytical. What I'm talking about today is analytical research. The most reliable type of research of this kind is called a double-blind placebo. The type of research is clearly defined in each trial before it begins. Now, clinical trials to put a new drug on the market, generally speaking, are in three phases. They want to ask, first, is it safe? Then, is it effective for what you want to achieve? And that's generally where the double-blind studies come in. And then they do an open-label study where everybody gets the medication, and more detailed tests are then given. Now, the literature that Parke Davis puts out will say something like this. Lopid, or gemfibrozole, is used along with a proper diet to help lower fats, also known as triglycerides, and raise the good cholesterol fraction, HDL, in the bloodstream. It may also help to lower the bad or LDL cholesterol. Lopid belongs to a group of drugs called fibrates. It works by decreasing the amount of fat produced by our livers. I mentioned in the last episode that fat is produced, metabolized, and stored a bit in the liver. Too much, obviously, is a bad idea. In big letters, it will also say, avoid alcohol. If you drink a serious amount of alcohol while taking Lopid, very serious interactions can occur. Now, the more common side effects that can occur with the use of Lopid include, generally, starting off with GI stuff, stomach upset, stomach pain, nausea or vomiting, diarrhea or constipation. You can also get a rash or dizziness, headache, changes in the way things taste, and even muscle pain. You may want to call your doctor right away if you have any of these side effects, just to run it by him or her. The more serious side effects can include gallbladder, liver, or muscles. You may get gallstones, which could appear as a severe pain in your abdomen. It may come with nausea and vomiting. You can also occasionally get what's called muscle toxicity, which may occur as severe pain, tenderness, or muscle weakness. Now, if you get dark-colored urine, also call your doctor right away. Now, if people taking Lopid drink a decent amount of alcohol, you can get some liver problems. Your liver function tests will rise, and you can get abdominal pain or even inflammation of the pancreas. In addition, Lopid has to be taken 30 minutes before mealtime, and this can be confining for some. Okay, now, back to the story. In the 1990s, I was involved with an open-label treatment trial of Lopid before it entered into the market. The trial was designed and paid for by Parke-Davis, which again is now part of Pfizer. Some of the risk factors I mentioned were discovered during this and in later open-label clinical trials. In addition, later on, Lopid in rat studies produced a significant increase in liver tumors in the treated group at high doses. The liver tumors were not discovered until the rats were fed higher doses over the lifespan of a rat, which is about 2 years. So, back in the 90s, when I was working for a group of cardiologists, I was approached by the RN and introduced to the study protocol. We then had to fly to Chicago for a 2-hour meeting. Seems a little silly now. Where we were essentially handed a 3-ring binder notebook with all the details. So the study basically went like this. After initial blood work and interviews, participants were instructed on the standard American Heart Association diet for the treatment of cardiovascular disease. After the diet instruction, they were asked to write down everything they ate and drank for 1 week, and then received nursing and nutrition counseling every week for 8 weeks. This was done to determine how much their cholesterol levels, including LDL, HDL, and triglyceride, would be affected with diet alone. After that period of time, the 8 weeks of nutrition counseling given to everyone, participants were then given Lopid for several months. I then saw them once per month rather than once per week. In my opinion, one of the key parts of the study was this. All participants getting the diet instruction and counseling were also getting something else, TLC, and lots of positive encouragement. And this is interesting. It is a lot of work to write down everything you eat and drink for a week. Without a single exception that I can remember, they all did the work. They seemed happy to see the nurse and I when they arrived and exchanged pleasant banter back and forth with us. The nurse and I both celebrated their victories with the diet record, their compliance with the AHA diet, and their attendance with their scheduled appointments, which was also excellent. And then we realized that something amazing was happening. The nurse walked into my office and said that she had just looked at the labs for the participants following the diet. 75% of them had lowered their cholesterol significantly. That is a ridiculously high number for any group of people following dietary instruction on almost any diet. Then she said, "That's the good news. The bad news is that Parke-Davis has designed the study to kick out anyone who dropped their cholesterol numbers by following the diet before the drug was given." What was also going on was that these people were getting frequent time with us, positive reinforcement, advice, congrats for their efforts, and lots of overall personal care. But Parke-Davis was paying for this study because they wanted to show that their drug Lopid could lower the cholesterol numbers. So the diet-compliant people were kicked out of the study because we were able to show that diet alone lowered cholesterol numbers significantly in 75% of the people in the study. This is what I mean when I refer to the imperfectness of cholesterol-lowering drug trials. The published results at the end showed that the cholesterol numbers improved on Lopid, but the amazing results from the diet alone portion of the study were not published. And that is because the diet-compliant patients were kicked out of the study. The 75% of total participants were kicked out of the study. Since that early study, there have been others that make the benefit-risk ratio more complicated. One study was from the Journal of the American Medical Association and suggests that the benefit of Lopid was less dependent on triglycerides and HDL levels than on insulin resistance or metabolic syndrome. In other words, Lopid may have been benefiting insulin resistance or control of blood sugars. Their theory is that Lopid might prevent initial fatty streaks on the wall of the artery from becoming bad lesions that can lead to plaque buildup on the artery. And this benefit may be directly tied in to a better control of blood sugars. I'll leave the article in the show notes for you. I'll also give you the link to a troubling FDA report on Lopid and a related drug called clofibrate. Here was a quote from the report. Quote, "The potential benefit of gemfibrozole in treating type 2A patients with elevations of LDL cholesterol only is not likely to outweigh the risk. Lopid is also not indicated for the treatment of patients with low HDL cholesterol as their only lipid abnormality." The FDA mentions that they come to this conclusion because of multiple risk factors from taking Lopid and clofibrate. In another portion, they say twice as many clofibrate-treated subjects developed cholelithiasis, gallstones, and cholecystitis, inflammation of the gallbladder, that required surgery. They also raised troubling questions about pancreatitis and liver cancer. Now, it is clearly up to you and your doctor to decide whether this or any medication is worth the risk. My point to doing this episode is to suggest to you that you have a choice. The cholesterol numbers will improve with diet alone. And I want to remind all of us that almost any medication will eventually cause side effects at higher doses. The takeaway message is that 75% of participants in the study, all cardiac patients, with frequent interactions between them and their dietitian or nurse, were able to lower their cholesterol numbers enough to avoid the drugs altogether, which is pretty cool, in my opinion. That's all I have for you today. Be well, and stay tuned next week for another episode of Healing Outside the Box.